My name is Latoya Cotton, and today I'll be discussing technology and the future of healthcare. As technology improves every day, new developments are constantly infiltrating our lives, whether it's the way we shop, how we communicate with friends, the job we do, or even the way we travel. Technology has even transformed the way we behave. There's research that indicates the internet addiction, particularly among younger demographics such as teenagers, is becoming a widespread issue. Take healthcare, for example. Breakthroughs in information gathering, research, treatments, and communication have given medical providers new tools to work with and fresh ways to practice medicine. Let's not forget the most obvious way technology has changed healthcare by providing new machines, medicines, and treatments that aids in saving lives and improve the chance of recovery for billions. Not only do sophisticated medical practices help patients heal directly, new technology has also improved research so experts can make healthcare even more effective. Airborne aerosols, infectious viral particles that can float or drift around in the air. Aerosols are emitted by a person infected with coronavirus, even one with no symptoms, when they talk, breathe, cough, or sneeze. Another person can breathe in these aerosols and become infected with the virus. Aerosol can remain in the air for up to 3 hours. That's why masks have helped prevent the spread. When someone who has COVID-19 cough or exhales, they release droplets of infection. Coronavirus is a worldwide public health emergency, and the disease has been spreading globally at an alarming rate. There's an urgent need to reduce the healthcare transmission risk among healthcare workers and patients in hospital due to the pandemic. In the indoor environment, the respiratory infection can be transmitted via direct contact with surface contaminated by respiratory droplets, by inhaling airborne respiratory aerosol, or by fecal oral transmission. These professional measures are indispensable to effectively control respiratory disease, including protection, social distancing, routine disinfection, and a control of the indoor environment. It is in these types of situations that molecular diagnostic methods can provide the data needed more rapidly. In July 2021, the CDC advised vaccinated and unvaccinated to wear masks in public indoor places in areas with substantial or higher transmission of the disease. The CDC has always advised unvaccinated people to mask indoor. One factor is the rise of the Delta variant, which even spreads more easily than other variants. So, the Delta variant is now the dominant variant in the United States. Infection control. Minimize the chance of exposure. Avoid gatherings of people and practicing social distancing can help reduce the chance of the virus. Promote the use of everyday preventive action. Clean your hands. Cover coughs and sneezes. Protect high-risk population. People with underlying health condition. People who work in healthcare or other critical infrastructure jobs. Technology that we have today are synchronosis. That includes real-time telephone or live audio-video interaction, typically with a patient using a smartphone or tablet. Asynchronosis, this includes store and forward, a technology where messages, images, or data are collected at one point in time and interpreted or respond to later, such as patient portals. Remote patient monitoring. This allows direct transmission of patients' clinical measurements from a distance to their healthcare provider. The benefits and potential of using telehealth is services facility public health mitigation strategies during this pandemic by increasing social distancing. These services can be safer option for HCP and patients by reducing potential infectious exposure. They can reduce the strain on healthcare systems by minimizing the surge of patient demand. Maintaining continuity of the care of the extent possible can avoid additional negative consequences from delayed prevented chronic routine care. Telehealth services can be used to screen patients who may have COVID 19, provide low risk urgent care for non COVID 19 conditions, access primary care providers and specialists, provide coaching and support, participate in physical therapy, occupational therapy, monitor clinical signs of certain chronic medical conditions such as blood pressure, engage in case management, follow up with patients after hospitalization, deliver advanced care planning and counseling to patients, provide non-emergent care to residents in long-term facilities, and provide education and training for HPC. So technology drives healthcare more than any other force. And in the future, it will continue to develop in a dramatic way.